at a time of unprecedented change in all our public services, and as we set out yet again on a restructuring of the National Health Service, I want to take a few moments to reflect on the origins and values of a public health system which has served us well for so long, and to see what lessons there are that may help us with the challenges ahead and give us a fair chance of establishing a system which will be robust and protect the health of the population in the years to come.
For 5.5 days a week they work. At noon on Saturday, the weekend holiday starts.
In this short video, I will be helped by some of the powerful public information films created in the 1940s, just at the start of the modern welfare state and the beginnings of the National Health Service. These films give a fascinating glimpse into the way we lived then. It's easy to think we're looking at a different world. But in reality, many of the challenges faced by the emerging welfare state then are much the same as they are today. And I'm also going to make use of the number 3. It's a really helpful number to describe the 3 determinants of public health and the so-called tripartite structure of the National Health Service, set up in 1948 and making an uncanny comeback right now. The 3 determinants of public health are the biological, the environmental and the social. Over the last century, many of the biological determinants of good public health have been tackled and controlled, but the challenges to health through environmental and social determinants remain very strong. The original public health movement, starting in the 1840s, had a very strong emphasis on sanitation, on slums and improving housing and the environmental conditions. As a society, we've made good progress in establishing the link between a healthy environment and healthy people. Safe working practices and measures to ensure safe food and good sanitation are now enshrined in law. It's the social determinants that we really understand least and have been less able to influence. Where once we worked and spent our leisure time together, we have now become more isolated. Our fragmented society means more and more people are suffering from loneliness and depression, and put alongside the difficult economic climate, it's a recipe for trouble, particularly among our most vulnerable people. And you know, I think we have to change our way of thinking. Right now, health and social care workers are like lifesavers beside a fast-flowing river. Every so often, a drowning person comes down, they jump in, pull them out and resuscitate them, and just as they've finished doing that, somebody else comes down the river. So busy are they doing it that they don't have time to walk upstream and see who's pushing everybody in. What we have to do over the next decades is look upstream. We need to pay attention to keeping people well, and that's not just the job of the health professionals, it's up to all of us. But before we consider how public health services can protect and improve our health, I want to go back. One of my most treasured possessions is this huge publication, produced by the Royal Institute of Public Health for its Liverpool Congress in 1903. The fact that public health operated from within local authorities maintained that very strong link set up in the 19th century between social, economic and environmental protections and good health. When the NHS was established in 1948, it had a tripartite structure. And this is where we return to our helpful number 3. There were the hospital boards, the community health services, which included general practice, dentistry, opticians and pharmacists, and there were the local authority public health departments. Roll on a generation to when I started out in public health, and that structure was being dismantled. The medical officer of health was abolished, and the new post of community physician established in health authorities, bereft of resources and with little direct influence over the determinants of health. And now, a generation on, the latest structural changes have put public health back where it started, within local government. The return of public health to its home in local government is an opportunity for local authorities to assume again a leadership and stewardship role in protecting our health and well-being. At best, it should mean public health professionals will be able to work effectively with people at a local level. In the Northwest and Cumbria, where I was a Director of Public Health for many years, we worked closely with community leaders to bring health initiatives right into people's neighbourhoods. This way we could work with people for whom traditional health services were often too late or out of reach. But at worst, it could mean public health being pushed to the margins. And what a tragedy if these later structural changes actually leave vulnerable people at risk. In the end, it has to come down to values, what we value in life and where our priorities lie. As local authorities resume the stewardship of public health, we're placing faith in them to respond to the challenge to improve and protect public health for many, many years to come. But how this is done is the key challenge, and nothing should be taken for granted. We need to find ways to protect and promote the aims of health improvement laid down all those years ago, whatever changes we may face in the future. The challenge is ours. The future is in our hands.